My name's Ahmed, and I am the chairman of the National Care Association. Has anyone ever heard of the National Care Association? A few of you. That's always, oh well, I'm glad to know you have. But it's an absolute pleasure to be here. If you want to know more about us, we are here for a little while, but we represent small to medium-sized care providers throughout the country. So actually raising standards, this is a great session because that's what it's all about. And when I came into the care sector in 1981, we did not have anybody who was incontinent in our services. It's a very different service. And actually we've raised expectations on the service, and it's quite right and proper that we should be looking at how we raise standards. And we've got really good organisations out there, like Skills for Care, who you'll hear about. And there is the Social Care Institute for Excellence, who I think are going to be on as well. So there are lots and lots of people who are actually trying to help and support providers. We've got the commissioning arm, obviously, who work with us on occasions to try and raise the standards as well. So I think it's a no-brainer when we talk about raising standards in social care, especially when it comes to safeguarding. I chaired the very first Kent Safeguarding Board many, many years ago, starting to look at how we were going to track it, how we were going to track how the process that once a complaint came in, what happened. And actually within a few years, we noticed that the complaints that we were getting were on the upward trajectory, which for a few minutes, it looked like it was a bit of a panic situation. Why are there so many? But of course, what that means is that people are much more aware. They're much more aware of what they need to do. And I think it also helped us, certainly within Kent, to try and understand how we brought that back together again. So I'm hoping this session will be interactive and lots of questions. I'm not actually chairing it, but I sort of seem to be taking that role. I'm not going to say very much more, except that I think as a care provider and somebody who's run businesses in the past, I think it's absolutely essential that we're clear that the people that we're looking after have the very best service that's actually possible. And that depends on good leadership. Of course it depends on good leadership. And it depends on being proactive in how you create the environment, the culture within a service to make sure that that can happen. And it's open, transparent culture where staff feel safe as well to talk about what's going on in services, because we can only improve the service if we all actually share what's going on. But I'm going to hand over to my colleagues because they're going to tell you how this can all happen.
Can you hear me okay? Yeah. So my name is Margaret Sharpe and I work for Skills for Care. I'm the locality manager for South East London. Have you come across Skills for Care before? Some people have. I'm very conscious that we've got a very good mix of people here today. So I'm going to assume that some of you will not have come across social care very much before. But what I want to just do is tell you a little bit about Skills for Care. We are the employer-led leadership and workforce development body, and we work across England, and we currently work with about 18,000 providers. So we've got a lot of access to a lot of people across the country. We support the social care workforce around the whole sort of area, really, from careers right the way through to leadership and management, right the way through to working with social work and working with commissioners. So we cover the whole aspect of social care. We also work with the sector to share best practice and to make sure, as Nadra says, that respect and dignity are at the heart of services. So a few years ago, we had some funding for innovation work, and we commissioned a report from the Institute for Public Care at Brookes University in Oxford. And they carried out a piece of research looking at actually what was happening in terms of safeguarding across the social care sector. And they carried out a literature review, and they found that there was actually very little information available about safeguarding across the social care sector. A lot of the information was very qualitative, so it was based on people's views, and there was a lot of information about resources and guidance, and actually very little information about what was actually happening. However, they did write a report, and it's available on our website, and what I thought I'd do just in terms of setting the scene is to take you through some of the key findings of that report. So in terms of incidence and prevalence of safeguarding and adult abuse issues, they found that it's actually very hard to measure that accurately. The information is very difficult to come by. But what they did find was that the older people are the main group of people who receive adult safeguarding referrals, followed by people who've got learning disabilities, people who've got physical disabilities and sensory impairment, and people with mental health problems as well. So physical abuse was the most frequently reported type of concern, and multiple abuse, which involved physical abuse as well. So there might be lots of different reasons why that was the case. They found that in residential settings, that physical abuse was the most frequently reported type of abuse. And in domiciliary care settings, they found that financial abuse was the most frequently reported type of abuse. They also find that male staff are overrepresented in referrals of abuse. So we know that the sector tends to be female-dominated. Roughly 80% of the sector are female staff. So the fact that male staff were overreported as being the alleged perpetrators was obviously a concern. They also looked at what some of the risk factors might be, and they found that older women and people who live in residential care and people who live in out-of-area placements are at the greatest risk of abuse. They found a whole range of different risk factors, which we need to think about, which include both staff and service user characteristics, the staffing levels and the use of agency staff, weak management and leadership, low levels of training and development, the organisational environment, and geographical isolation. So these are obviously some of the concerns which they picked up. In terms of thinking about risk assessment and personalisation, so there's currently a very large move towards personalisation, which obviously does carry some risks. So what they found was that the majority of social care practitioners found that they were experiencing dilemmas and tensions in balancing a positive approach to risk-taking along with their safeguarding responsibilities. So they were having that dilemma about weighing up what people want to happen versus concerns about their safety. They also find that there's currently not a lot of information or evidence about the impact of personalisation and personal budgets, which is both individual personal budgets and personal health budgets, on the effect of safeguarding. So that's still a bit of an unknown quantity at the moment. So when they looked at how is policy actually translating into practice, because most care organisations will have a lovely safeguarding policy, they may follow the local authority's lead. Unfortunately, what happens sometimes in services is that those policies sit on the shelf and they are very, very often not ever used very, very frequently. So what they found was that there were gaps between the policies which the organisations had and the actual implementation of those policies at a local level. What they found was that staff were able to follow procedures in very clear or very extreme situations. But when it came to cases that were a bit more complex, they often went back to their own personal judgment, which obviously is a risk because each person will judge a situation completely differently. What they also found was that staff did have a good understanding about abuse, but it varied in terms of what different types of abuse they talked about. So most staff were aware of physical, psychological, financial and sexual abuse, but they had less understanding of neglect and service user to service user abuse as well. There seems to be almost a bit of a tacit expectation that that's okay for somebody who has got some condition to assault somebody who's got a condition as well. So they also find that in terms of reporting abuse and whistleblowing, that one of the major barriers for staff is about a lack of confidence. So you can imagine in terms of power dynamics that it's actually very difficult for somebody who maybe works with somebody a few hours a week to actually raise concerns about their care and support. They also found, not surprisingly, that safeguarding procedures are very stressful for staff, managers and the people being supported. They also found that there was a lack of support for staff who were exonerated after an accusation of abuse. They also find that On the positive side, safeguarding was an increasing component of staff training, and this is obviously coming through from more recently the care certificate is actually embedding that quite well. However, they did find that for people who employ personal assistants with direct payments, that there sometimes are gaps in terms of vetting the candidates to work with those individual people. They also found that the low levels of staff training was a significant risk factor in abuse. They did find that training does improve knowledge of safeguarding by about 20%, but there's obviously quite a long way to go. So there's obviously opportunities there for more discussions and conversations with staff rather than just offering staff training. They also find that multi-agency working is associated with higher levels of referrals. So people working together and talking to each other increases the rate of referral. However, sometimes information sharing is not good enough and it actually impedes some of that multi-agency working. They also found a limited awareness of the Mental Capacity Act and the deprivation of liberty safeguards, and that staff often weren't very aware of what their legal obligations were. They also found that serious case reviews were very useful, as we heard this morning, and some of the areas that came up as concerns across many safeguarding reviews was issues about staff training and supervision, multi-agency communication, lack of clarity about roles and responsibilities, deficits in risk management and assessment, concerns about whistleblowing not taking place, the organisational culture perhaps not supporting where blame is given rather than actually being welcomed, and the increased use of agency staff. On the positive side, they did find that reviewing safeguarding incidents actually did change practice on a more local level. So to help address some of these issues, Skills for Care has created a large number of resources, and not to go through each of them one by one, which would probably send you all to sleep. On the table over there on the left-hand side are a number of those resources, and I'd be very happy to talk to you about those during the break. So I'm going to pass over to Neil Cox from CQC to talk about how some of the things that they've found on a more practical level has impacted on the sector.
Hello, can everyone hear me okay? I always want, for the people of my age, I always think of Norman Collier when I've got a microphone in front of me. So just following on from what Margaret was saying, when we were talking about presenting today, we were thinking about what is going to help raise standards and linking it into safeguarding. I want to start off by saying that 8 out of 10 services in this country are rated good or outstanding, so 80% of services are providing safe, effective care. So we need to hold that when we think about things like safeguarding. But we do need to focus on where things haven't quite gone as well as they could have done. And we also need to think about how we can get better at making sure that safeguarding concerns are looked at and investigated correctly. So I've just picked out some themes from some of our inspection reports that cross all of our directorates, so hospitals, primary medical services and adult social care, and picked out some of the key themes. And they're not too different to what Margaret was saying, so I won't repeat them ad infinitum. But the overwhelming view of people in inadequate services, and we look at safeguarding under our key question of safe, surprisingly, is that people don't feel safe, and they express that to us either by directly telling us on inspection, or by contacting us via the contact centre, or by relatives telling us that they're worried about the safety of their loved one. So, and in an inadequate service, that's generally the sort of feedback we start to get when we're in the homes inspecting. Incidents and accidents are not reported because staff don't feel able to do that, linking into what Margaret was saying. And that comes back to, I was pleased to hear Nigel say about the culture of an organisation. That comes back directly to how the service is led and how opportunities for learning are viewed rather than it being as a blame culture. And I think that's something we all need to think about. How are we embedding the safeguarding policies and procedures into staff practice so that they feel comfortable to raise concerns? Because if they're not going to tell you, and that then increases the risk to people, and we clearly don't want that. The lack of a registered manager is key to there's a clear link, to inadequate rated services and the lack of a registered manager. And it has to come from both provider level and registered manager level about the culture, about the openness and transparency. And I can't stress that enough, because as leaders, and I'm sure there are many leaders in this room, you're the ones that can directly affect how staff react to safeguarding concerns. You're the ones that have got the power to do that. And if you associate it with a blame in a blaming way, a blameworthy way, then staff aren't going to be comfortable raising it with you. And we need to think about that when we're having discussions with staff, how we encourage them to learn and encourage them to speak up. Whistleblowing policies clearly need to be in place and acted upon, and staff need to feel that they are listened to. And again, that all links into staff meetings, what value is placed on safeguarding at staff meetings, whether it's a standing item on the agenda, all those sorts of things. But that's the really inadequate things. That's the things that we find when we go out and inspect that aren't in place. Lack of training. And in particular, one of the things we do look at as well is where safeguarding referrals have been made, what's the cooperation like between the local authority and the provider? Because that links into whether that service is well led or not. You'd be pleased to know 80% of services get it right, which is great. So relatives and those people where we go out on inspections, they tell us they feel safe. You know, I can tell any member of staff this. If I saw something, I'd do that. They're really confident in saying, I'm happy to raise a concern. Relatives, people, whatever. And our expectation, as I'm sure is the same in the entire room, is that should be welcomed. So if there is a concern raised, no matter how small, you should be acting upon that, and you should be addressing that as best you can. It doesn't always have to be a formal complaint before we act. So it really is important that open culture, that way of listening to and acting on concerns that are raised, even albeit minor ones, are done. It is done, sorry. The registered manager is clearly linked to that, and again, I won't bang on about the links around inadequate services, but with a good and outstanding service, there's generally, I think about 85% of the time, there's a for outstanding services certainly, 85% of the time there's a good registered manager in post who is supported by the provider, who buys into the cultures and values of the organisation. So it's really key that we all think about how we act as leaders and how we act as managers. One of the questions we were asked about is how we develop good working relationships, in particular our safeguarding colleagues from the local authorities and health colleagues across CCGs, commissioners. I think from the Commission's perspective, it's about developing those professional working relationships. It's about being clear what our roles and responsibilities are. We had a really helpful presentation from the LGO Social Care Ombudsman, about what roles and responsibilities. It's being clear and setting those out, what people's expectations are about each individual organisation, what our expectations are from providers, what CQC expectations are, and what the local authority expectations are. And it's only by having those open and honest conversations about safeguarding that we can get things right for people. Because if we don't listen and communicate and challenge in the right way, we're not going to get it absolutely right all the time. So I think it's important that everyone in this room has that sort of thought, reflects about what's my role in safeguarding, what's my role in making sure that the person at the centre of this is supported through the process, and making sure that we're all doing the right thing for that person as well, and their relatives and loved ones. There's not much else I want to say, because I'm guessing we're going to get a barrage of questions, and you can all ask Nadia rather than me questions, it's fine. So I'll hand back to her.
I think the questions will all be for you, Neil. Thank you for that, and I think that's a great overview, because actually the partnership bit is really important, because without a good, strong partnership between everybody, we won't get to where we want to get to. And so I think, events like this where you bring everybody together and, we all participate are crucial. They're absolutely crucial, because leadership within our sector is often looked at within the general sector as being something that is missing sometimes. And the greatest leaders are those in those really good and excellent services out there who are doing the best that they can. So I think it's really important to applaud ourselves for everything that goes well. But then we also have to search to see how we can make it better, because ultimately we're all there for the vulnerable people that we look after in whichever sphere it is. And currently we're obviously looking here at the care home sector. So we're going to open it out to questions rather than statements. So who's going to, are there any flourishing questions out there? Well, in that case, I'll just ask the first question. How about that? I'll ask the first question and see if that stimulates some thought and some conversations. And I'm going to ask Neil, actually, around the CQC. We hear a lot about the poor cases that hit the television, obviously, and how did that get missed? I mean, what is it that we can do as a sector to try and eliminate some of that? This is not just about the inspectors going in. This is about how do we sort of change the image, because I really worry about the image of social care, because every safeguarding incident that happens, everything, it hits the press, and then we're in a really difficult position. Both of you, I mean, do you think the image question is an important one, or is it an irrelevant one?
Thanks for that question. I think bad news is news, isn't it? I think that's the world we live in. From the Commission's perspective, it is I like to think there is a collaborative approach to the way we regulate. That isn't all. We don't always get it right. We don't always. We're not a perfect organisation. No one is. We try our best. I think it's about collaborative working. The sector itself, within adult social care, well, the health sector as well, is. We seem to be game for every paper when something goes wrong. And I think what we need to do is where we can, and I think our Chief Inspector, Andrea, does this very well, is champion adult social care and make sure that is at the forefront. It's not just about bad care, but it's setting expectations quite rightly, but it's also making sure we push back and say, looking at what is good in the sector and celebrating the fact that 80% of services are good or outstanding. And I think that's the key message. And I think only by doing that consistently can we get the message across. But it's not going to be an easy one to crack, unfortunately.
Yeah. So just to add to that about how sometimes bad news makes the headlines. Every year, Skills for Care runs an accolades programme where we basically ask the social care sector to bid for an accolade across a number of different areas. And each year, The Guardian sponsors that, and after the awards ceremony in March, they always do a feature on the winners of that. So please keep an eye out on that. And when it happens, if you are somebody who tweets, then obviously then you can tweet that. But on a more local level, we actually ask people to become eye care ambassadors, because basically what we want people to do is, those who work in the sector, is to go out and talk to other people about it. Because if you listen to somebody who's talking about their job passionately and about how fantastic it is and like how fantastic social care is, the more likely it is that they're going to take that message away and then talk to other people about it as well. We basically set up the Eye Care Ambassador service to help to kind of encourage the positive message, but also to try and encourage recruitment into the sector. Because I would imagine that if you're a young person just about to leave school and you see all these negative images on TV about social care and about how crap it is, then people then aren't going to want to actually work in that sector. And I think that we've all got a responsibility to actually try and change that image and to try and to change the message that's going out there.
Thank you. Anyone else got any thoughts or comments or questions even? No? Well, I think I would just want to then reflect on something else that's really important within our sector, and that is to focus on something that we know. What we know is the demographics are very clear. In adult social care, in care, they're very, very clear that we are going to need more care, not less. And so to get it right is essential. We cannot fail in this. Safeguarding came in, and it's been the result of a number. Does anyone remember the granny business? Is anyone as old as me? With the Mortimer homes? No, I'm the oldest person in the room, obviously, or the oldest person in social care that exists here. Well, that's where it all started, which was a learning disability service, and it was a reactionary thing to bring safeguarding to the fore because commissioners were really slammed for it. And then subsequently we've had many more. We've had the Winterbourne View, and each time something happens, safeguarding comes to the fore. And of course the failings that are actually brought to the fore have an impact on every business, and every time something happens, and actually, if you think about Winterbourne View, it was actually a hospital. It wasn't social care provision, but that said, mid-staff, it was an NHS provision. It wasn't a social care provision. Again, that said, whatever happens, social care gets it, and we can't. I mean, I think it would be remiss of me as a representative of the social care care providers here to mention the fact that there's been less investment in social care over the last 10 years than there's ever been. And so I think we just need to be clear about we're now looking after people. And this is where I think safeguarding is interesting. We're now looking after people that were looked after in long-stay geriatric hospitals. We're actually a health care service. We're not just a social care service. We're providing health care. And sometimes the people that we employ to deliver that have not got the adequate training. So just bear with me. If you're in a hospital bed and you're ready for discharge, you're in that bed, it will cost the state over £2,000 a week. If you go into a social care setting, it'll cost the state £500 if you're lucky. We've heard of less being paid. But actually the needs of the individual don't change. We actually still have to deliver all that care. And some of that funding, when you've got people with Parkinson's, you've got people maybe stroke victims. So I think we have to think about that sometimes as the people, the level of care we're now providing, if we're not then training people up. Training is crucial. Not just in safeguarding, training in recognition of condition is crucial. And that's the only thing that will eliminate some of the challenges that we face as a sector. So I think we have to think that through, wouldn't you? I mean, training, I was declaring an interest, the Vice Chairman of Skills for Care for 11 years, and it was set up really because we recognised that we needed those skills to be actually going in there, because it's only if you actually train people to actually recognise those issues that we're going to get to where we're going to get to. I can carry on talking, but I am very conscious the floor is for you. Nobody wants to talk to me. You like my dulcet tones, obviously. Much rather listen to me. Yes.
To make a bit more of a statement than a question, but the reason raising standards in care homes is of interest to the board is because a third of the investigations in Bromley relate in care homes. So it's so significant in terms of our commitment and resources. Last year we received in total 3,500 alerts, which were from professionals and from members of the public, which we had to sift through and raise those concerns. At the moment, we've got 48 open safeguardings which relate to care homes. So this is why it's an important feature for the board to be able to consider how it's going to raise standards within the care homes, and with all the professionals going into care homes or into nursing homes, it's very important. Bromley doesn't have one outstanding home. It has good homes, and essentially, obviously, what we'd like to do is make our sector move towards the outstanding, and we work very much with organisations which are failing, and we work very closely with CQC in trying to raise those standards within those homes.
No, picking up on that point actually, around raising standards, the next phase of regulation, which is starting on the 1st of November for all sectors, but adult social care as well, is there is going to be a renewed focus on services that are not achieving the rating of good. So it's recognised from our statistics from the inspections we've completed, is that when a service goes into special measures, it is rated inadequate. About 80% of the time, when we go back out, it improves. 20% it doesn't. With required improvement services, we're going back out and we're finding that 50% of them are not improving to a good rating. So there is a new real focus within the Commission to look at how do we encourage that, be that through signposting, using colleagues with National Care, whoever it might be, the Skills for Care team, or the other side of it, then using our enforcement powers to make sure that we are getting providers where they need to be. And we're drawing not drawing a line in the sand, but there is a real clarity of purpose from our perspective about what we can't have is requires improvement services for 3 years in a row, because that's the potential. Every year you'll get an inspection if you requires improvement. And Andrea's made a very public commitment that we're not going to allow that, or we don't want that to happen, and we want to work and find a way to get services to good. So it's just from the 1st of November we will be looking at how do we encourage services that can't get to good to get there, and if they can't or won't, more importantly won't, what do we do about that? And I think that's going to lead to some interesting challenges as well.
Oh, question. Just before I come to you, I'm terribly excited.
Be totally applicable to care homes, but just in my experience, I think over the years, the patients need greater care, which, as you said, that in care homes now, the level of care is far higher. In the community, the district nurses are dealing with people that would be in hospital for months on end, going back years. And what I see is I think we're working sadly more separately as organisations rather than coming together. Because we've all got budget constraints, we're all coming from our own angle, rather than saying the words the patient is at the centre. I'm not sure we're always very good at meaningfully doing that. We've got the issue of carers unable to wash legs and apply compression hosiery because that's not in their remit now, or apply eye drops for long-standing eye complaints, not post-operatively. The knock-on is then on the district nurses to pick that up, and the knock-on and the knock-on and the knock-on. And I think because of budget constraints and what we're all doing, actually, we're just moving a problem, not solving it.
I couldn't agree with you more, because actually the pathways to care, which we talked about, and this whole thing about integration, they talk about integration on a regular basis. I get bored with it. I go all over around the country and I get told how NHS, there's got to be integration. Actually, you're right, people are still working in silos, people are very protective of their budgets, and there's a huge challenge, and there lies the challenge. Actually, when you talk about the number of alerts you have, it'd be really interesting to say how many of them are proven as well, how much, what happens, and that's really interesting, because we've actually looked at all of that raw data within the National Care Association, and there is abuse going on which is unreported, and it is published through the NCA, of people in their own homes as well, because they're so vulnerable, and it's usually through families, and so we have to be really careful that people are working in silence. And the only people we're all letting down by doing that is the vulnerable people that we care for. So if we actually work on that basis, and I think that's where this new kind of from the 1st of November, looking at how we do bring those improvements. In Norfolk, there is a great programme, because the local authority, when they actually hear that they've got a home that requires improvement, they've got somebody who actually goes into that home. It's saving them loads of money, because they're going into that home, looking at that home, and then actually working on how they can help support that home come to good, or raise them from inadequate through, I keep forgetting the terminology, you change it so much now. So I think, your point is really well made, and that's why I said earlier on, partnerships is really, really important. And when I actually joined the board of Skills for Care all those years ago, when it was actually formed, it was such a pleasure, because we were sitting around the table with commissioners, there were providers, there was the voluntary sector, everybody was around that table, and that was for the first time. So commonality occurred, because I think a lot of the time what I get to hear is that the providers have to be done too. They don't sit around the table. And then you get families who feel that they need to do too as well. And I don't want to create a victim mentality here, because sometimes providers are wrong. Obviously, just like sometimes CQC inspectors are wrong. as if I would ever say that in public, fortunately. But, you know, that is just the way it is. There is inconsistencies. We're all human beings and we don't get it right. But it's about being able to be transparent, which is a really important point about being able to be transparent. And if you're in a trusting partnership, when you get things wrong, you will tell the people that you got it wrong. And actually, I think inspectors have a bit of a job to do about gaining the trust, and so that if they say that actually we didn't get that quite right, they're not going to have the door slammed in their face as though they're going to shut you down. So I think there are all sorts of elements. Any further comments? Gentleman there.
Thank you. From a police perspective, I'd just be interested to get your views on the amount of regulation, or in particular what appears to me to be a lack of regulation around the recruitment process for staff in care homes. I speak as someone who is a police officer, but I also have a preschool, so I know how much regulation there is around employing staff to work with children, and I just think there's a bit of a gap when it comes to the prevention of abuse. We've got cases that we're going to discuss later. When it comes to the prevention of abuse, in terms of looking at potential employees' previous history, I'd just like to get your views, really.
Right. Shall I start and just say the legislation is very clear about recruitment of staff for care home sector. So this includes children's services, although we don't represent children's services. We have a really good DBS service, and our members can access it at a very, very cheap rate. I think since the DBS service has been set up, we are a little bit better. However, I sit on the Home Office Committee, which looks at migrant workers, etc., etc. And on that committee, whenever I speak to the police officers and some other people around the table, they actually don't think that those DBS checks are all they should be. Now, that isn't the fault of the sector, because we've been told. But I would still say, and I think everybody has to have a DBS and they have to do it, but there is nothing that I think is better than last following up references and last employees, because I think when there's a gap, and people have stopped doing that because they think they've got a DBS, they're done. But actually, you must actually look at where the person's employment history is and try and get references. That's my view. But you'll come back to me, but I didn't know whether anybody else had a view before. Did you want to come back to me specifically? Absolutely. No, absolutely. The managers are DBS checked by CQC to be fit persons, but nobody can start working in, well, they can work supervised until the DBS check comes through, but they are required to have a DBS check.
Just picking up on that, as you said, the registered manager will get a DBS via CQC. It's the provider's responsibility to ensure that they follow the Schedule 3 of the Health and Social Care Act, and to make sure that all that history is looked at. Where that doesn't happen, we find out about it, that's a breach of regulation potentially, etc. I suppose the only issue that I'm guessing people in this room might have experienced is false documents. And the type of documents that people present and how they can effectively spot that, because as inspectors, when we go out and see a copy, we wouldn't necessarily know. It's very difficult for providers to know whether it's a forged or forged document. So I think there's support for providers around how they do that. For me.
And just to add to that the picture is going to actually get a bit more complex, because I understand that from next year, people who are individual employers actually employing somebody using their individual personal budget are going to be responsible for checking if somebody's got the right to work in the UK. So we're actually asking people who are actually receiving services to then carry out checks on people. So we're actually asking people to do a lot with actually very little guidance. So I think it's a really, really good question.
And that committee that I sit on in the Home Office, the ECHO committee, is about forged documents, and they acknowledge that care providers can't, these documents, some of them are so good that we can't, and actually, you know, we go through when you drop the driver's license, the sound that it makes and all of that. And we ran a course in Croydon not very long ago where we got the Home Office officials to come down, and we had providers in the room, our membership was in the room, and they were putting up pictures of how can you tell. And actually, it was really enlightening. I think Karen was there, and you know, some things that never change, which you as a police officer would know when you looked at it. But what you have to remember is care providers are not police officers. And so there is that element that we have to be careful about. It's a really great question. Thank you. Anyone else? Sorry, you've had your name up for a while. Your hand up.
Sorry, just in regard to the last question from the officer in relation to DBS checks. Of course, whilst it's you have to have a DBS check, that's only a UK DBS check. The number of foreign workers or European workers in the sector is quite high, although there is the option to make checks of European countries. That's not very often taken up. I've been personally involved in 2 cases where those who have been the subject of allegations in safeguarding have had quite serious criminal matters outstanding against them, one in Poland and one in Spain. So that's something from a regulatory point of view needs to be looked at. But I agree the fact that providers need to be supported in relation to identification checks. But my question, twofold question was, firstly, a general one is, and I work at Bromley CCG, and the care home subject is coming up time and time again. We know that health and the social care sector has got to work more closely together. My answer is, especially in relation to small and medium providers, how can we work better together to support those, especially those small and medium-sized providers who don't have the sort of resources that larger ones do? And my second sort of more general question is in relation to technology. So allegations, we know, you look on television, allegations are often solved through social media, CCTV and that sort of thing. Perhaps we're a little bit old-fashioned in safeguarding where it's still one person's word against the other. So how can technology support safeguarding, not only in the investigation, but also in empowerment and prevention in relation to safeguarding?
Well, I've been told that I had 5 minutes ago when you first started talking that was left with us, and now it's 4 or maybe 3. So just very, very quick questions, quick answers to that. The bit about how small to medium-sized homes can be reached, I mean, obviously that's what we exist for, National Care Association, we're a national body. But all I would say is that invite people onto your boards. I mean, I find it really difficult that on the welfare board, on the well-being boards, on lots and lots of boards that actually have integration at the heart of them, you don't have social care providers sitting around the table. And I know that's sometimes difficult because they're individuals and all of that, but I think until we start to get that mix done, I sit on boards, I'm the only social care provider and I've got everybody else. NHS trusts, you can't get a social care provider on an NHS trust around CCGs. So I think that's, I don't know if anybody else wants to take that quickly, because I think I'm very conscious that we're time-wise.
Yeah. I think there are lots of ways actually supporting those smaller organisations. Perhaps if we maybe have a conversation afterwards. So last year, Skills for Care were given some funding by the Department of Health because they think that the registered manager's role is the most important role, and they gave us some funding to help support registered manager networks across the country. There's currently 2 across South East London, so I'm actually looking for more than that because of the number of providers across the area. So I'd be very happy to speak to anybody who's interested in actually setting up a registered managers network, but that's certainly a way in which people can come together. There's also a huge amount of free resources out there. So, for example, all the stuff on the table over there is free, and there's access to lots of people who can actually offer support on an individual level by actually going to visit services and actually to help to try and support some of those people who actually are working in very, very difficult circumstances.
Well, I don't think we can go any more. That's it. We're finished. Thank you so much. Thank you to both of you for your support. Thank you for listening. Thanks. Bye-bye.